Welcome to this video looking at equality and diversity as part of the BTEC Health and Social Care course. This relates to the coursework unit, Unit 5, particularly Section A, P1 of the coursework criteria. So I'm going to talk through these materials, definitions, these concepts, how they apply to the course, and then how we can relate them to our case study characters for when we begin writing. So the first question is, what is equality? Now, the definitions of equality vary, and this definition here says the right of different groups of people to have a similar social position, opportunities, and receive the same treatment. And in a general sense, being equal would mean having the same or being treated the same. Now, in this context, it is useful, this definition, but in terms of health and social care and thinking about equality, if we treated everyone the same, as this image shows, some groups would be disadvantaged, some groups wouldn't have the same opportunity, and some groups would have an even better opportunity than they already have. The word equity is probably a better word to use in the sense of giving everyone the same opportunities, the same access by making and offering different levels of support. Now, when we talk about equality in health and social care, we talk about it in a different way. We talk about equal access. So we talk about equality in terms of giving people equal access to services, the quality of service, and really it's about meeting their needs, regardless of where they live, how they live, what their circumstances are, making sure everyone is given the same opportunities, the same service, and the same treatment, rather than giving everyone exactly the same treatments as everyone else. We tailor it to meet the needs of the individual. And ultimately, and a good example of this is everyone has the right to register with a DOTS. That is an element of equality. But an equal need access would be the idea that someone who's chronically ill would get more time with a doctor than someone who is relatively healthy. Another key concept is diversity, and a lot of people ask what diversity is. Now, diversity ultimately means that we have a variety of differences. There is a range of different people in society. Now, to value diversity is to respect and value cultures and beliefs of different people. If you didn't take the time to understand different cultures, you wouldn't be able to meet their needs, and therefore you wouldn't be able to give them the right care that these individuals need. And also, it's a legal requirement for most health and social care organisations, and actually most organisations generally, to value all individuals irrespective of religious, cultural attitudes, and a number of other factors. So when it comes to diversity, Britain is a multicultural society, and as a result we have a big range of different people with different needs, abilities, different ethnicities, religions, cultures, classes, ages, genders, sexualities. Is a very broad spectrum of people, so we are multicultural, multiple cultures. So when we're providing healthcare, when we're providing any kind of care service, it's important to be aware of these differences so that you are providing people with the right care, you're treating them properly. And what this has done is it's beneficial for healthcare because it leads to new forms of treatment, it leads to different ways of delivering healthcare, and it leads to learning opportunities for professionals and practitioners to improve their skills and abilities. And ultimately, a good service provider will value diversity. So that's equality and diversity. Now, all of this is important for a number of reasons. So again, treating people as individuals, taking into account their needs, this can be good for healthcare. And ultimately, it means that the person feels valued, feels at the centre of care, and we get the care provided that meets their needs. So for example, if a person's religious belief means they can't eat certain foods, or they have to pray at a certain time, they would feel undervalued if the hospital didn't accommodate those. Now, part of this, and the reason we want to make sure we provide equal treatment, we recognise diversity, is this is all now enforced by the Equality Act. Now, the Equality Act was introduced in 2010, and prior to this, we had loads and loads and loads of different legislation, different bills, different charters and acts that provided bits of equality, bits of regulation, bits of requirements to meet the needs of individuals. So these different policies covered class and gender, religion, ethnicity, disability, sexuality, and it was a bit of a mess. There was hundreds of these, and it made it quite difficult when companies would breach them to kind of sufficiently bring charges against them. Now, this was updated in 2010 in the Equality Act, when it tidied up the whole process. It narrowed it down to one policy, one act, one law, and it provided greater protection to a greater number of people. So this policy was introduced to provide a wider range of protection. Now, this information comes from the Equality and Human Rights Commission, and they talk about who is protected. So under the Equality Act of 2010, there are 9 core protected groups: age, disability, gender reassignment, or gender generally. They talk about marriage and civil partnerships, paternity, pregnancy, maternity, race, religion, belief, sexuality, or sexual orientation, sorry, and physical sex, whether you're male or female. So there's a lot of protected groups, and these are being amended and changed. I know recently, for example, around Christmas time, veganism, I think, was incorporated into the belief element of a protected characteristic to prevent discrimination. So these are updated and changed as we go, so do keep an eye on them, and particularly events in the news. Now, what this means, how they're protected, is that any private, public, voluntary organisation that treats people differently because of these different characteristics could be breaking the law. And if you feel you've been a victim of this, the action you would take if you feel you're being discriminated is to complain to the organisation, and they must do something about it. If they don't, then under the Equality Act, you could take this to court, you could sue the organisation, and potentially you could speak to a lawyer or raise it with a council, an education board. So essentially, if you feel you've been discriminated, you'd raise it with someone to take action. In some cases, this could be the police. Now, the public sector equality duties, or the PSED, means that basically any public sector organisation is duty bound to promote equality, prevent discrimination, and treat people with equal opportunity. And ultimately, this public body could be schools, it can be hospitals, it can be care settings, community-based programs, but ultimately it's all about trying to protect people, give them equal access, and improve the overall service. And one element on here that doesn't often get discussed is positive action. So this Equality Act can also lead to positive and allow positive action, where public bodies can provide additional support to people through benefits, through mentoring, through a welfare program, to reduce the impact of disadvantage a group might experience. So for example, people from the gypsy and traveller community, they may be disadvantaged in education for various number of reasons, and this positive action can allow support or extra support to be provided to that group to bring them to a level on par with everyone else. So it's a bit coming back to that equity image we showed at the beginning. Now, one of the impacts, if we don't provide equality, if we don't recognise diversity, this can be discrimination, and there are different ways discrimination can occur. So there are 4 key forms of discrimination. Unfair discrimination is when someone is treated unfairly. So you're not considered for a job because you're older, you have a disability, your ethnicity, your gender. This would put you off from getting a job. That would be unfair discrimination. Direct discrimination is when someone is rude or offensive to someone because they are different, because of a protected characteristic. So this could be, as the example says, when someone who is overweight, it's called names. It's a form of discrimination. It's often easier to prove because there may be witnesses to it, whereas unfair discrimination could be harder because the argument could be that someone's better skilled or better qualified for a job. Indirect discrimination, again, is slightly harder one to prove, but often it might be that a member of staff is not specifically discriminating against you because of your characteristic in an obvious way. So it might be that they appear supportive to a member of staff, but they dismiss their ideas, or they don't acknowledge their concerns, they ignore what they say. So their discrimination is kind of a lower level, and it's more about maybe not taking action as opposed to directly discriminating against them. And then lastly, positive discrimination. Now, this is one where someone is given more opportunities than someone else because of their characteristics. So someone is given opportunities of promotion or a job because of their ethnicity, because of their gender. because of their sort of awareness issues, and it might just be because maybe in the sense of companies trying to avoid discrimination, they often then might go as far as becoming an overly positive discrimination. So they're giving too many opportunities to people from different protected characteristics, and that can, again, it's an odd form of discrimination, but it also comes under discrimination. So why is it important to prevent this? Now, there are lots of effects discrimination can have on individuals. It can cause them to lose their self-esteem. It can trigger mental illness. They can live in fear or be scared that they're going to be attacked or discriminated against by lots of different people. It causes stress, and stress can lead to illness. You lose a sense of yourself and who you are. You might withdraw from social activities. It can lead to depression and anxiety. You can lose your confidence. You might not want to seek support. You might not want to seek treatment because you feel attacked and victimized. You might not be able to work. So these are all the negative effects of being discriminated, and really the importance of equality and diversity is to prevent this from happening. Now, discrimination can affect people in a number of ways, and some of the other ways that you can be affected is as it has an impact on your personal development. So physical development, intellectual development, emotional development, and social development. Now, this diagram is one that kind of just highlights some of the ways the different forms of development are affected if you were to be victimized by discrimination, but also in a positive way. If you are given equal access and treatment, then these can positively affect your different areas of development. So as we discussed, it's really important to prevent discrimination in a care setting or in a public body. So care workers will take lots of actions to prevent discrimination, and often will have practices or policies which promote anti-discriminatory practice. Some of the initiatives that could be used to prevent discrimination in care would be looking at stuff like access. How do organisations avoid discrimination in accessing the services and facilities? Is there anything that can be done in terms of diet and providing catering services for individuals with specific needs? What support might be offered in the setting to help people access facilities, access activities, or engage or interact with other people, particularly maybe thinking about language barriers, and also advocacy services. So does someone need an advocate to work on or speak on their behalf when providing support? These could all be ways of thinking about support preventing discrimination. It will also have a link back to some of the distinction criteria, which we'll discuss in a later video. So ultimately, why we need equality and diversity. It prevents discrimination, ensures people are treated according to their need, promotes self-esteem, protects the rights of the individual, creates a society where everyone and their differences are appreciated and tolerated, and it creates a society where everyone has an equal chance to succeed. So let's look at some examples relating to what we've discussed so far. So this first case study example says, I use a wheelchair to get around and I'm finding it very hard to access my place at a local college. I want to study science and the labs are on the first floor. The college hasn't got a lift and they say that they can't afford to have one put in just for me, so I must go somewhere else. Travelling any distance is really difficult and expensive, so I don't want to go to another college. Now, if we were to think about these questions, what is the protected characteristic being discriminated against? So in this case, it will come under disability. Is it or could it be unlawful to discriminate under the 2010 Equality Act? We know disability is a protected characteristic, so any discrimination based on disability would be unlawful. And the action the person could take could be to speak to the local educational authority. They could raise it with local councillors or council or MP. They could go to charitable organisations working with disability or students with disabilities. They could even, if they were really concerned, go to the press. So a concept we talk about called whistleblowing, which is something that will come up later in the course. These will be actions that person could take. Another example, linking into education again, is I am an Irish traveller. I live on a permanent site now, which we don't move around anymore, which is great because I get to stay at the same school. The other day, when I was in school, I heard a teacher making horrible comments about gypsies and travellers. They were saying that our site should be shut down and we are trouble. Now, again, in the same process, we're looking at, we could look at this as a belief system, we could look at it as an ethnicity group. This would be a protected characteristic, and this discrimination is unlawful. Now, this is an individual teacher making these comments, so the person could report it to the school, they could report it to the Board of Governors, they could report it to Ofsted, they could report it to a number of organisations that they have been the victim of discrimination by this teacher. And last but not least, another one example is I was refused an apprenticeship at a local hairdresser's because I wear an hijab. And they say that all staff must wear their hair in trendy styles to impress the customers. I'm not prepared to do this as it is against my beliefs. So again, the characteristic we're looking at here is religion. It is unlawful to discriminate against someone by religion and by bringing this saying that they cannot or they shouldn't wear their hijab because that's a religious article of clothing that is allowed. And again, the action could be taken is they could report this to local business groups, they could report it to the council, they could report it to, again, a number of organisations, the company, these to raise their concerns that they have been discriminated against. So, to start wrapping up, the next steps for you. Now, you will be given a case study sheet with 6 case study characters on it. So that's Patrick, Nusrat, Alice, Brenda, Martin, and Maria, and Maria's mum. So you're going to get 2 characters in that final case study, a bit of a buy one get one free case study. Now you need to choose 2 characters from the case study sheets, and what I'd recommend is read through all the case study characters, look at their issues, look at their needs, look at their story, and try and choose 2 people that you would feel happy to spend time writing about over the course of the next 6-7 months, because you'll be writing about them for a lot of the coursework, and you want to choose people that you're interested in, that you think there is a lot to write about, all the stuff that you can say, and that you would be interested in researching the issues around them. So, for example, Martin has been made redundant, he has a skin condition, he has reading difficulties. Now, if that doesn't interest you, and you don't really care about Martin's issues, don't pick him. Because in 7 months' time, when you're still trying to write about Martin, and you're not interested, it's going to make it harder. Whereas, for example, if you're interested in Patrick, you're interested in discrimination met by same-sex couples or people with HIV, then, or potential HIV, that could be something to worth looking into, because you'll be doing a lot of research around the topic. Now, once you've chosen your 2 people, the next step again, what you can do before you start thinking about writing your one, is just take a look at one case study and think about what to consider. So if we look at Nusrat, you might want to think about what is the character, what's their story, what's going on? Are they part of a protected group? Have they got a characteristic protected by the Equality Act? Do they have a specific need or a support that has to be provided, and is it being provided? Are they using the community centre for any specific reason? Why are they using that community centre? What can the staff do? What support should be offered? Is there any evidence of discrimination, potential discrimination, and what effect could that have? What are the community centre doing to support them? What could be done? What are the staff doing? Does it have an effect on their PIEs, so that physical, intellectual, emotional and social development? And this can also be positive and negative. If it has a positive effect on their development, you can discuss that, as well as negative effects. What arrangements could be offered, what has been put in place, and what else could be done to support the characters? These could just be some starting questions to think about with your chosen character, just to get some ideas before you start writing the P1 section. And what I will do is I'll do a follow-up video to this one, talking about how to actually write P1, what to think about, what to include, and what to do. Okay, so thanks for watching. Hopefully this has been of help. Any questions, any concerns, get in touch with your teachers. They'll be able to talk through it, and hopefully this will get you prepared for the first piece of coursework, or first little bit of the coursework, which is the section P1. Thanks for watching.